Dr. Quinn, have you seen this in patients you have treated?
Most definitely, and it's something that should be really taken seriously. We actually have a clinic every Saturday morning where we see individuals to come in, some appointments, some walk-ins. And over the years, I've had a lot of my athletes to come in on a Saturday morning that participated in football on the previous Friday night. One thing that I assess very aggressively if I suspect a concussion is if when they first took the blow to the head, that's when they took the hit and they had symptoms of concussion such as dizziness, headache, confusion. Did they stay in the game? And I work very hard to encourage my students to understand they need to get out of the game if they suffer concussion, because if they have a second concussion by staying in the game, then there's a higher probability they can have that post-concussion syndrome, meaning those symptoms can last for over a month, years, or they could even have brain damage or lose their life.
What are some typical signs and symptoms of a person suffering from post-concussion syndrome, and how serious is it?
It can be very serious. Some of these signs and symptoms, initially a person has a concussion, and typically that person will articulate that they're having headaches, maybe light sensitivity where light bothers them, makes the headaches even worse. They can have decreased concentration, confusion, problems in school. I actually watched a lot of presentations in preparation for this talk, and some of the students, they were unable to matriculate in school. But typically this post-concussion syndrome, you're still having symptoms that normally self-resolve in maybe a couple of days or a couple of weeks, but if they persist on for 4 weeks or more, then you're in post-concussion mode. But the take home is it's very important that you seek treatment, get under a medical provider. If you see a family physician such as myself, there's a high probability we'll refer you to a neurologist, which is a neurological specialist, and basically they will treat the symptoms, and in most cases it'll resolve, but it can be very serious.
Yeah, it sure can. So what is your advice overall about concussions?
Well, the most important advice that I can give patients is to understand that it's something that does not need to be ignored. If you're a student, you have a child playing sports, if they suffer concussion with these symptoms, get them out of the game. But also note, on tomorrow, the Neurotrauma Symposium, it's going to be at the Westin Hotel in downtown Jackson tomorrow all day. And someone can go to the website, which is MississippiBrainInjury.org, to register. It's going to be a great event. I'm going to be speaking live, not Zoom, and we're going to help a lot of people get a lot of good information.
Absolutely. I'm going to be there too as an MC all day long, beginning at 7:30. So it's going to be a lot of fun, and it's going to be great for folks to even see you in person, Dr. Quinn.
Hey, I can't wait to get there.
Yeah, me too.